Good morning. Welcome back into Wake Up America. Take a look at your screens here. We've been showing this throughout the morning. This is one of many train stations in Poland, just over the border with Ukraine. As you wake up this morning, the refugee numbers as this humanitarian crisis gets worse and worse now exceed 2 million. The number could be closer to 5 million by the end of the week. According to the United Nations, 100 people from Ukraine, not just Ukrainians, people coming from Ukraine, though, are crossing into neighboring NATO countries every single minute. They include Poland, Romania, Hungary. You can see Belarus to the north, which is friendly to Russia. But Poland, by far, seeing the highest numbers here. Again, over 2 million people have fled Ukraine over the last 13 days. Major cities in Ukraine remain surrounded this morning, including the capital of Kyiv, which is almost 500 miles from the closest bordering point with Poland to the west. The medicine supplies have almost been impossible to get. People with medical conditions, serious conditions like cancer, can't get the treatment that they need, and many can't travel 500 miles to the border. For more on what this all means, let's bring in Northwell Health Dr. Frank Contessessa back with us on the show. Dr. Frank, good to see you again. This is something that people probably aren't considering and thinking about, but a lot of people that are getting treatment for various medical conditions, they don't have the ability to travel. What does that mean?
Well, it's a difficult situation. Good morning. And when I watch these reports, we talk about the political implications and going to war and all of the political ramifications. But when I watch these reports, I think about exactly what you're saying, people who aren't getting their medications, people who are showing up at hospitals that aren't able to treat them. And, when you look at the pictures of all these refugees, what you don't see? You don't see many elderly sick people, because most of them are probably still stuck in nursing homes or in hospitals, and they're not able to make the journey and escape. So the tragedy of that, it really sticks into my mind when I watch these reports. Again, you're showing these pictures. You don't see many, older, sicker people. You're also running short on medication. So people who have routine conditions like high blood pressure, they might have atrial fibrillation where you need blood thinners. And if you go a short period of time without your medications, you run serious complications like blood clots. Diabetics may not be able to get their insulin.
Right.
So really after a short period of time, if the supplies run short, you're looking at a really dire situation.
Yeah, and we think of the convenience, if you've got a prescription to fill up, you have your doctor call in and then you drive down the street and you pick it up, no problem. Russia controls approximately 30% of the electricity and energy in Ukraine right now. If the power goes out at these hospitals, a lot of people are going to be in a really bad way. On top of that, if you are a nurse or doctor, I realize that you swear a Hippocratic oath to your patients. But if you're dealing with evacuating your family, a lot of these nurses and doctors have been forced to make really tough decisions. Do they stay behind with their patients, or do they evacuate and abandon these cities, which are now being indiscriminately shelled and bombed in many, many places?
Sure. Well, I'm glad I'm not having to make that decision.
Right.
It would be a very difficult thing to do. I'm not sure what the answer is. I certainly would hate to have to make the choice of evacuating my family and taking care of my personal needs, or protecting the people that I swore an oath to protect. I'm just really thankful that I'm not in that position.
Doctor, what can we do to help these people besides, from a political level, sending aid and that sort of thing? What can we do?
Well, I think we have to try to get them as much of the aid as we can. They just need supplies. We need to get them these medications. If there's a way to try to help to get people out and evacuate, that's really all we can do. I've seen some really great charity organizations that are trying to get aid in and getting people out. Yael Eckstein with, I think it's the Coalition of Christians and Jews.
Yep.
Looked like a really nice organization, and they're doing a lot. But we have to really think of these implications. You even mentioned the power supply. If power goes down and we lose services like water, if we don't have clean water, you're looking at infectious disease outbreaks, cholera, dysentery. It's just a complete disaster.
Yeah, and it's a chain reaction once it begins. Dr. Frank Contessessa, great to see you again. Thanks so much for the information. We appreciate it as always.
Thanks for having me.